This conference will now be recorded.
I was diagnosed with RMC in April 2019. So roughly almost 2 years, going on 2 years. Back in September, my scans was clear. So next week I actually got my third scan since everything been clear or whatever. So
Good.
yeah, one
Great,
3
great
scans in.
news. Great news.
Nice.
Yeah,
Andre,
so,
what was your basic course of treatment? Just, what was it that you did?
I did 11. So I did 11 treatments of chemotherapy. It was gemcitabine and doxorubicin. That worked for a little while, but after a while, I guess it stopped being as what's the word? The cancer
Effective.
less effective. So they switched me to immunotherapy. I did that for maybe 4 cycles. That was it helped a little while too. Then it started being less effective. Then after that, I had another round of about 6 rounds of chemo, cisplatin. That worked out for a little while, and that helped. I think the most beneficial chemo that helped me, I kind of did a combination of chemo and radiation. So I did 6 cycles of carboplatin and gemcitabine in conjunction with 28 cycles of radiation. So I would go do radiation once a day, Monday through Friday for 28 days. And then after that, that killed the rest of the cancer cells, and everything was clear after that.
Wow.
Yeah, a lot of chemo, a lot of immunotherapy, a lot of radiation.
And just out of curiosity, what was the immuno?
I don't know right this minute, but I can get that information to you before we dismiss from the meeting or whatever. But I gotta go look my
Is that the
files.
one that started with an I?
Yep.
Ipilimumab?
Yeah.
That's it right there. Yep.
It's a tongue twister.
Good call, though. Good. That started with an I. Is that?
All right. Well, Andre, why don't you go on and let's just open up. I had gone on and started recording so that people wouldn't miss out on some of the things.
Okay. Well, good evening, everybody. Happy New Year to everybody. Hope everybody is doing well going into this new year. I know 2020 was a tough one or whatever, but it's just a blessing to make it back to this new year. So hopefully everybody is doing well. I see we got 2 new people on here. I never met. So we got Lori and is that Michael? Is that correct? So I kind of gave my introduction. So if Lois and Carissa and Richie, if y'all can kind of give y'all an introduction, introduce yourselves, and let everybody know who you are. You can go ahead, Lois.
So, okay. Hey, everybody. Happy New Year. I'm from Greece, for those who don't know me. I've got a case with my 15-year-old daughter. She was diagnosed with RMC. Actually, 2 months after she was hospitalized with metastasized cancer of unknown source. And 2 months later, and that came in beginning of May, they came with a diagnosis of RMC, which is actually the first recorded case in Greece. Never heard of it before. And after our contact with Houston and the lovely ladies, actually we started with RMC support group We found a Facebook page, and that's how we got a contact with the Riches organization later as well. The chemo started actually in March with my daughter. I'm trying to remember the drugs she originally used prior to the diagnosis, because she started therapy. What the protocol here in Greece was for these cases, for these tumors, actually. Dr. Rubicin, I think, addressed that. It was one of them, paclitaxel and cisplatin, the three of them. And she had these on a weekly basis for about 2 months, 10 chemos, 10 weekly chemo sessions. And then she continued with gemcitabine only, I think, or with something else for a couple of rounds in summer, but we didn't have a good progress, let's say, a good effect. They were not that effective, that scheme. And that's when the cancer had a metastasis to her right breast, from the lung to the right breast. We got panicked, and then doctors from MD Anderson sort of contacted our doctors again. And in August, we started another chemotherapy, which actually is based on 2 cycles that alternate. And the drugs there are some of the original therapy, cisplatin and paclitaxel and gemcitabine. And the other round consists of gemcitabine, bortezomib, and cisplatin. There are 2 cycles, CPG and BC. Anyway, these are the 5 or 6 substances that alternate. And that will go on, I think, if I'm right, until March. And if we look forward to a clear scan, the last scan in beginning of December was very, very good. Many areas, lymphs around her armpits were neutralized, and the only areas here now are in the right lung and in the breast, but the signal was very, very low this time. Half of the signal we had in PET scan of August. And the doctors were really happy with that result. It's not totally clear now, but we hope. So actually we have just 2 small areas now to fight, let's say. And then probably from what they said, of course they're going to discuss that. There's going to be another year, maybe, 1 or maybe 1.5, which is somehow maintenance, let's say. How can I say that? Did you have that, Andre? The second year, what was the drug you took? 2 drugs?
Yeah, so they're maintenance drugs, so maintenance chemo. I know in my case, they use the chemo to shrink the cancer down till it was small enough. I only had, it was one area that was they was concerned about, and that's why I went through the radiation. But yeah,
Where was that area? Which part?
in my lymph nodes that was close to my the kidney that was removed. So my right kidney, it was in the lymph node.
You had your kidney removed.
I did.
Right. Okay. With Fenina, this was not possible because once we found out, it was already spread in several parts. In the beginning, it was in the liver, in the right kidney, lymphs, lung, even bones. But after 2 months of therapy, the only area that was left was in the lung area. But in the summer, got a bit more, spread a bit more to some lymphs around the armpits and the breast. And that's why they changed the chemos. And actually now they seem to be quite effective at the moment. And we hope to keep it that way. And yeah. It was very aggressive in the beginning. At the time of the diagnosis, I could hardly see any part of her that was not affected, so to speak. Yeah, it was horrible, and no operation could be performed because if it is spread, they can't do anything. But they said it was very good that the body responded to the first 2 months and healed, or let's say there were all these parts were had formed necrosis in the liver, in the kidney, and yeah, only this area of the lung remained, let's say. Yeah. So at the moment we are fighting with these two areas, actually, just a small part in the breast area and in the lung. There, all these areas are in the right part of the body. And the PET scan was sort of quite good because the signal was very, very low this time, 3.5 and 4.5 in the two areas. They were 8 and 9 in August. And after these 4 months, yeah, it went down. We'll see how we'll go on. Yeah, that's all about Fenina so far.
You know, we'll keep praying for you. I would like
I know,
for,
I know, I know. Thank
yeah.
you. She regained her weight. I mean, when the whole adventure started, she was almost 79, 59 kilos. And in June, she was down to 45. And now she regained her weight. She feels quite strong. Happy most of the time. She doesn't want to stay in hospital at all, just for the chemos. And the only thing is that we can't be at home because the hospital is about 2.5 hours away. So we stay in a hostel there. Thank God that there is a hostel for the families who live far from the hospital. But 3 out of 4 weeks in a month, we live in another place. She's separated from her little brother, so either me or my husband accompany her in the city where the hospital is, because we live in a regional town. Anyway, we got used to this routine, and yeah, we try to keep her sort of happy most of the time.
Yes, good.
Yeah, she's
Well,
an optimism. I think helps a lot. I see that it has a healing effect, I think, in the body. I don't know. Maybe I want to feel like that. Anyway, she tries to smile most of the time, and I think it's good for her.
it is. Staying positive is important. I will, Andre is back. We lost him there for a minute, but I just wanted to explain to Laurie and Michael the type group that this is. It is a peer-to-peer group. We really don't have any agenda. we come in and allow you to ask questions or speak whatever is on your mind. And so we would like either one of you to just introduce yourselves, Michael or Laurie, whichever one to go first. We would love to know a little bit. I know Laurie a little bit and what she's gone through, but I don't know Michael at all.
I can go first. If you know Lori's situation, you actually know a little bit about mine. Me and Lori are here for the same person.
Okay.
My partner, her goddaughter, Kwanzaa, was diagnosed late October, early November. Actually, really more mid-November. With RMC. We hunted around getting second and third opinions for surgery, chemo. Got in touch with Houston, MD Anderson. Talked about. I mean, me and Kwanzaa even thought about, all right, do we need to move to Texas for a little bit? And we're able to find a really fantastic hospital that Lori helped us find that was able to do a surgery. She had the why am I tripping right now on which side it was? It was her left side, right, Lori? Yeah, it's her left kidney. And they did the surgery to take it out in December, early December. She healed up really quickly. I was kind of astounded. The night she came home from the surgery, she was like a stick figure. And like by the end of the week, had most of her range of motion back and stuff. And she's just been like fascinated with her like surgery marks and like picking at them. I have to stop her every now and again. Which is fun, like retribution, because she does that with me, with pimples. And so, yeah, she was healing up from the surgery. She had her first round of chemo the Monday before Christmas, and then that has been kind of hard on her. We just found out that like some of the things we were worried were like other things coming up, like constipation or things like that, have been really just some like pretty heavy chemo side effects from her first round. She's actually in the hospital right now. She might get on the call, but they had to give her some hydration and some pretty intense nausea meds. But she's doing a lot better than when she went in there a couple days ago.
It's wonderful.
How old is the
Kwanzaa is 27. Yep, 27, originally from Georgia. Now she stays in Anaheim, California.
Oh, okay.
Okay.
So are you from Georgia as well?
I am not. I am a Motor City boy, Detroit, Michigan, born and bred.
Oh, okay. You're a lot of fun. I love to meet you personally. And that's what is it Kwanzaa?
Yep.
That's what she needs. She needs a lot of positivity right now. This is not an easy journey. So take the negativity out and bring the positive vibes in. Okay, and then Laurie.
I think Michael's pretty much hit most of the important things. I think we really struggled with, and I may have to move my computer because here I've got my power cable here. We really struggled in the beginning. We knew that we were doing something a little unusual in having the surgery first instead of going straight to chemo, but the doctors felt they had an unusual opportunity to get it. Because we didn't have that many metastases. We just had lymph nodes and kidney involvement as far as they could tell. So it was like, okay, they wanted to go in and take out this kidney and stop whatever spreading was happening from that. And it was causing her enormous pain. So we were all behind like, yeah, get that pain out of the way, because that's just, that plus the chemo was going to be a lot. And I would say, to add to what Michael's saying, my big question, I mean, I'm so impressed, Andre, and Lois, that in Lois's case, that your child has managed to go through so many rounds of chemo, because we just started cisplatin, and Kwanzaa has been depressed, but depressed for good reasons, but depressed because the intention was to do a round 1 week, do another round, then stop, then do another round, and we're now way off that schedule. And so the question was, should we be doing different chemo that doesn't have the nausea impact, or should we go straight to an ipilimumab? You know, should we add that in? Should we find some way to do something else while we're in this waiting for her to recover from just the first round? So that was just a question. Is that okay for me to say, Michael?
Yeah, go for it. Also, if anybody has tips on how you or your person found a new diet, because that has also been a little bit of a struggle for Kwanzaa. It's like everything tastes different to her now. And that's been like really bothering her, trying to eat and get some of her weight back.
And it takes time to get your weight back, and chemotherapy does tend to mess with your taste buds. And the best thing to do is, if it's something she finds she likes, just get it for her until she decides she doesn't want it anymore. But you know, I wouldn't try to force anything on her. Just let her decide, you know, what she want to eat. And I can speak for that nausea and vomiting because my son went through that too. And what we started doing with him was they did give him some anti-nausea medication each time he had his chemo prior to. And then he would get the chemo on Friday, but then on Monday they would hydrate him because by Sunday he was throwing up again. So he went through a rough time with that, but it doesn't affect everybody the same way.
Yeah, they're actually,
If I may,
I was just going to add real quick, they're actually, it's amazing you mentioned her because they're, she messaged me earlier, they're actually bringing a hydration station to the apartment. She told me it's supposed to be delivered like the next couple hours. So that like someone can come out and do her hydration between rounds as needed, because that does seem like it's helping at the hospital.
Mm-hmm.
And then, yeah, I also just want to echo what Lori was asking about, you know, like other chemos or ideas to maybe help that proactively in the next couple rounds. Because Kwanzaa is very dedicated to being done with her rounds. Her doctor originally told her 3 rounds, so that would have ended her like late February. Then after the surgery, he said he wanted to take it up to 6. And it's just after the side effects of this first one, she's like, I don't care what he said. This is over in February. And so that's her prayer right now. And so, yeah, just wanted to echo what Lori had.
sorry, don't they give her any medication for the nausea effect?
They
Do they
do.
give? They
We
do.
had like 4 different things. We had Zolfran, Reglan, Compazine, and also like Xanax, because she was also having some mild anxiety from, or more than mild, sometimes. Because to Lori's point, the pain she had from having the tumor, the previous hospital we were at had given her morphine, and she had been on it for about a month and started having some bad withdrawal symptoms after her surgery because they had sort of like lowered it to other opioids. And then eventually she, you know, wasn't feeling any pain. So she stopped taking even those opioids, and then withdrawal hit. And we didn't even know what that was for a couple days until we took her. And then the original hospital was like, yep, this is withdrawal. We're going to give you this med to help with withdrawal. And it was just like, all right, we're going to take that pill and here's another one. But thankfully that one seemed to help. But yeah, they have given her a bunch of nausea meds. But those like, what had us go to the hospital a couple days ago was that she took a nausea med and then she like was throwing up every hour. And it got to a point where she could take a nausea med, took the nausea med, and then like 10 minutes later threw it up. And it was like, okay, at this point we need someone else that needs to figure out what's going on right now that knows more than me and her.
So I got a quick question for y'all. Is her doctors in contact with Dr. Masal and some of the doctors at MD Anderson? Do they correspond with each other?
Yep, I think her doctor, and this is I think how he actually originally came onto Lori's radar, had published a paper with them, or was it just about RMC, Lori? Do you remember?
He had put out a note. He was the only doctor, or only one of 2 doctors in California that had ever been published on the internet saying anything about RMC, and he was referencing MD Anderson's paper. So that was the only way we found a doctor in California that seem to have any inclination or understanding that this was an important, an important cancer and needed to be dealt with. Yeah. But he seems really, he does know that doctor well, and he seems to, he's very connected into specialized cancer, urinary cancer. So we've been feeling good, really good about him. But thank you for asking, guys.
Laurie, I'm sorry I'm late. I'm moving between meetings today, and Michael, I'm delighted you found the right room. Where in California are you?
We're with City of Hope now. Kwanzaa, the patient, is in Anaheim. She lives in Anaheim, so she's about 20 minutes away from City of Hope.
And who are you seeing at City of Hope?
Dr. Powell is the oncologist.
I don't know. I mean, there's some really good GU med-oncs at City of Hope. There's 2 or 3 really good genitourinary medical oncologists at City of Hope. I was going to, if you were in Northern California, I had some other ideas. But in Southern, I mean, Tanya Dorf is terrific.
Okay.
She's really good. Now, how much work she does with kidney cancers, I'm not sure. If you were up in, I mean, I have a couple of docs I would have recommended at UCSF, but I think that Andre is right on the money in saying that whoever you're seeing, they need to be in touch with MD Anderson, because it just seems like however good the institution is in this country, it can be UCSF, it can be City of Hope, it can be Memorial Sloan Kettering, all roads lead back to Dr. Masoul and Dr. who's his right hand man there?
Tanir.
Tanir.
Yeah, I will say one thing I found, because I did a massive research thing around the literature that's available on the internet, aside from finding, of course, that almost everything is published out of MD Anderson. One of the things I sort of, and I know I'm not a medical professional, but when you push things through your head and you're reading it, you're like, what is happening? Why are they doing it? Why are they experimenting with these things? Why are they experimenting? It seems like the average genitourinary cancer specialist approaches this like it's renal cell carcinoma. They start down that path and they're like, oh, it's in the kidney, so it must be like renal cell carcinoma. And they start throwing these things at it that don't work because it's not like renal cell carcinoma. Right. And so we've been Michael will tell you, the last meeting I was in with Dr. Powell, he's like, well, we might try this. I'm like, nope, this study says, no, don't try that. Do not do that. That's like renal cell carcinoma. Don't go there. It's like, go someplace else, wherever you go. Don't go there.
Look, it's a small enough community in the first place in terms of finding a GU med-onc. I mean, there just aren't that many genitourinary medical oncologists. I mean, all too often it gets handled by a general medical oncologist. So you don't have many GU med-oncs in the first place. Now, not only do you not have too many GU med-oncs, but when it comes to RMC, it's a handful, or 2 or 3 maybe. So, yeah, but City of Hope is a good hospital. It's an NCCN hospital, and if you like the guy there and the guy's in touch with Dr. Masoul, I think that's the best combination that you're going to get. The other big issue sometimes is getting docs to work with each other. But I think when it comes to RMC, Dr. Masoul is so well recognized that most docs are going to say, yeah, we don't understand this cancer, and yeah, if Dr. Masoul wants to work with us, we'd be happy to have it.
And he's very easy to work with. He's extremely passionate about what he does, and I know he does approach each patient trying to shrink the tumor first. I mean, the only thing he does is give the suggestions, and of course the physician can do whatever the patient wishes, but very, very easy to work with.
Thank you for that. We really, really appreciate your support. I mean, poor Michael knows we missed the last appointment in December because Kwanzaa was being discharged from, I think, from her surgery that day. Yeah, her surgery that day. And we, like, all of us, just went, and didn't remember it. But we were like, gotta make it. And for, like I said, Michael's been like listening to me. I'm like texting him, don't forget, Tuesday, 5 o'clock, Tuesday. We have to be there. We have to be there. So I'm super grateful that we've made it. And we're super grateful for all of your encouragement and advice and thoughts.
And we are here for you. I mean, don't think you have to, travel this journey alone. That's the whole purpose of the support group. We're here for you. It's a tough road. It's like a roller coaster.
Do we have, Richie, do we have the email addresses for Michael and for Laurie so that they can get the reminders?
I don't have, I have Laurie's, but I don't have Michael's.
So
Because Laurie and I have emailed back and forth a little bit.
If both of you can put your email addresses in the chat window, if you just want to send them to me, to Rick Davis, or to everyone, it's up to you. And we'll make sure you get a reminder that goes out before each meeting, which will help you maybe not forget. But we'd be happy. And the other thing I would say, and I speak more for the moderators here, is that you don't have to wait for a meeting. These three people are so available to you if you need help, or you need support, or you need to talk to anybody. Just reach out during the period. Something may happen and your loved one may be experiencing something, you don't know what to do. The chances are Richie's seen it before.
I'm here for you.
Yeah, I have a question. I have a question for Michael and Laura. Are you guys working with like a supportive care doctor, like to help with like the symptoms as well?
That is such a good question, Carissa, because the one issue that we've had with City of Hope is getting their palliative service involved. And it is such a great question. And I actually can give you the name of, I'll look for it in a second. But I did some research probably a year and a half ago for somebody whose mother had lung cancer. And the chief oncologist was her doctor because he's a pulmonary oncologist. And he was giving them such grief about getting a palliative care doc involved at City of Hope. And it really, really bugged me. And in the end, we connected her to this very nice lady who had trained at Memorial Sloan Kettering, which is a great palliative care cancer center. And they were really happy with us. So give me a minute and I'll go look in my email, and I think I can probably come up with the name of the woman at City of Hope. But do you know what a palliative care doc does or is?
I would assume that this would be somebody who would do some of the things that we just had done in the last, why she's been in the hospital for the last 4 days. That it's going to be somebody who's going to look at her eating and her, her pain and her hydration and whatnot. That's what I would assume.
So the answer is yes, although that could well be the internist or the hospitalist. But the palliative care service is there to manage symptoms, which it sounds like is what you're talking about. And they are specialized in managing symptoms. So, and they have the experience with other cancer patients of managing symptoms. They're not end-of-life docs, which a lot of people think they are. So, Sharissa's called them what did you call them? What was the expression?
Oh, supportive care.
Yeah.
Supportive care. Yeah.
Supportive care is great. Symptom management is great. I think they call them palliative at City of Hope, if I remember rightly. But they are there to help address the symptoms.
Thank you.
Let me look. I'm going to look whilst you guys keep talking and see if I can find the name of that doctor for you.
Thank you.
Okay. Appreciate that, Rick. I want to make a quick introduction. We have Dr. Singh has joined us. He was my urology doctor up at Fort Belvoir in Virginia. So he was the first person to actually diagnose me with this cancer. So I'm gonna let him chime in and kind of introduce himself and kind of I guess let y'all know kind of what he saw, I guess, in my case, and anything he want to share with the group he can. Go ahead, Dr. Singh.
Thanks, Andre. Yeah. Hey, everybody. Nice to meet you. Sorry I was late. I was unfortunately on another call with another doctor. Yeah, Andre invited me to join the meeting, and I hope it's okay that I'm listening in, and I'm happy to serve as a resource if any way that it's appropriate. As Andre said, I was I was an Army urologist for a number of years. Actually, recently just got out of the Army, and I'm practicing in Pennsylvania now. But I've known Andre now for years, and it's obviously wonderful to see him looking and being so well after what you all know is a very, very difficult, scary roller coaster of a journey. So I as a urologist, I do a lot of cancer surgery, but renal medullary cancer, this is a cancer that requires very specialized physicians and teams, as you guys are all probably intimately aware. And so I probably can't answer a lot of your specific chemotherapy, immunotherapy, et cetera questions, but if there is something about the medical system or in general how it works, I'd be happy to help with that. Yeah, so happy to be here, and I'm happy to answer a question if it seems appropriate.
Okay, appreciate.
I was just going to say, Dr. Singh, would you have anything to add to what we said to Michael and to Laurie, especially regarding palliative service or anything else?
Yeah, so I mean, I agree with what you said. Palliative care is underutilized gem of a resource in general at a lot of major academic centers and other hospital systems. These doctors and teams obviously focus far. Their goal is how do you make a patient feel better, and so they come at things from a slightly different way than other doctors do. As surgeons and oftentimes oncologists, the goal is how do we get a patient to live longer and symptoms be damned to a certain extent. Not that doctors are obviously ignorant of that. It's just that's not the priority. And palliative care doctors, they come at it with that a priority is quality of life, and that's a very necessary thing in a lot of situations. So I think if there is a team that's good at that, then it's wonderful.
Thank you.
Appreciate that, Dr. Singh. I really appreciate everything you did for me. And with RMC, it's kind of, this cancer is a lot of times misdiagnosed. I know I was in so much pain. I had to go to the emergency room, and they thought it was kidney stones at one point in time. And this when I was on leave, so I was on leave back home, and I had to go to the emergency room. And then when I went back up to Virginia, I did a follow up with Dr. Singh to kind of let him know what was going on, as far as the pain, and they was able to do ultrasound and some PET scans and stuff like that, and get me diagnosed, because the quicker we can get this type of cancer diagnosed, the better off your odds will be in attacking it and defeating it or whatever. So Yeah, so appreciate it, Dr. Singh.
Happy to be here and happy to see you. And yeah, thank you.
If I may ask, Adre, do you also have a sickle cell trait?
Yes,
All
I
right.
do have a sickle cell trait. In my case, I didn't know I had the sickle cell trait.
Found out with the diagnosis?
I found out with the diagnosis. So, and I've been in the Army at that point in time 14 years, and I never been actually diagnosed with the actual trait.
Right.
I've
Anyway,
been
not that it matters, because we knew that we had this. I knew that my children have that, but we didn't know what it could cause, in certain
right.
circumstances of extreme, maybe exercise, or as Fenina was beginning of teenage years, she got very tall, been very athletic. And from what I heard, many people involved in exercise, physical exercise, are sort of struck by this kind of cancer. And it's a paradox here. A very healthy body, very sporty or athletic, it's something which is against the body, being extremely fit, maybe it's not that good for the sickle cell trait, actually. Maybe not too much exercise.
I think the
Right.
majority of the patients have been physically active. What about Kwanzaa? Was she involved in any sports at all?
Hi, I don't know if you all can see me.
Hi.
I'm Kwanzaa. I'm late.
Kwanzaa?
I'm literally at the hospital. I just got an ultrasound. But I wasn't athletic, but I was a teacher. And so teachers might as well be athletes the way that we are constantly on our feet. And I would say the last year that I was a teacher before switching careers, I was like not sitting down for most of the day, like ever. From like 7:15 in the morning to 5 o'clock in the afternoon. And so I would say that was probably the most active that I've been in my life, to be clocking that many steps and having to project and engage and talk and handle a lot of different things. So I would say I was pretty I would say that was the most fit I had been in my life.
I would like to say welcome Kwanzaa to the group. This here is a support group for everyone to share their experiences and to encourage and to uplift. So we appreciate you for joining us, and we're looking forward to your clear scans in the future. And I was letting Lori and Michael know that I was diagnosed in April 2019. I actually had my kidney surgery first, and the cancer metastasized to my lymph nodes. And that's when I decided to go down to MD Anderson. And I've been through several rounds of chemo, several rounds of immunotherapy, and several rounds of radiation. But if you keep your spirit high and keep chugging along and moving along, it will pay off in the end. And we all are here to help and support you. So if you need any advice or anything, I'm here. Richie's here. Richie has been an advocate for a long time for RMC. One of the Carissa, one of the first people I met when I came down to MD Anderson. I didn't know anything about RMC. I was just a soldier in the Army, and You know, it was a scary situation, but they helped support me and help uplift my spirits. And Carissa's late husband, Carlos, he was a big inspiration to me that kind of helped me along the way. Helped me get this port because the chemo was killing my arms or whatever. So, you know, he encouraged me. He was like, hey, get the port. You know, he said, no, he's okay. Touch it, feel it. He said it's fine, you know. So he was a big help for me. So we're definitely here to help and encourage you any way we can. I just say stay encouraged. You get to ring that bell and get that clear scan.
That's right. That's right. That's what I'm talking about. And Kwanzaa, we're here for you. And Clarissa is one of the ones that would tell you 24 hours, I mean it, because
Yeah.
my little sweet daughter over there, she would call me at 1 a.m. and 2 a.m. and I would answer. So I was there. So don't think you're on this road with just Michael and Laurie. We're here with you too. We're all a big family, and it's just wonderful. I feel like, what's that little lady in the shoe with all the children? She didn't know what to do. What's that rhyme? I'm getting old, you guys. But we're all here for you.
Kwanzaa, tell us a little bit about your own background, please.
Oh, okay, sure. So I'm originally from Georgia, a small town in Georgia. But I have kind of lived in every region at this point, and I have landed in Southern California. I was like, prior to diagnosis, I was working. I still am. My job is still there, thankfully. But I'm the director, or one of the directors, of a college access nonprofit that helps kids be the first in their family to go to college. And so that's what I was doing happily before, you know, pandemic hit. And I mean, cancer diagnosis alone is tough, but even in the midst of pandemic, got like just added a whole nother layer to it. So I'll just kind of talk about how I got here. In July of last year, 2020, I was having some bloody urine, and I was like, okay, like I've had UTIs and things like that before, and I went to urgent care not thinking it was a big deal, and they didn't make me feel any more concerned, but I was starting to have pains, and I was thinking like, maybe this is something else. And I went to the ER, and the ER doctor was like, hey, you know, don't be too fretful about it. We're in pandemic. It's civil unrest. You know, you're a Black woman. Like, you're probably just having a hard time. I'm just going to see you on some painkillers and let that be that. Don't, just try not to worry. And obviously it was, if he had done a scan at that time, I feel like my trajectory would have been a lot different, but I'm thankful I'm still here, and that wasn't the last say for my health. And so I went on until my birthday, which was in September, and I turned 27, and I had a great time. At the end of the month, I started to get some like weird pain, stomach pain kind of things, and I ended up, you know, going back to urgent care and being like, hey, you know, something's going on. They're like, well, maybe it's your gallbladder, maybe it's this, maybe it's that. And then I go into October, where I end up going to the ER, and they do a scan, and they find a tumor on my left kidney. And from there, I kind of bopped around until I found the right place. And I was able to get surgery before chemo. So I had surgery December 7th. So they took my kidney, and it did spread to my adrenal gland and to my lymph nodes. So I got all of that taken out, and now I'm in chemo, and I've done one dose of chemo, and it kind of set me on this path and for nausea, vomiting. I think Michael and Lori might have shared about that, which is why I'm in the hospital currently, trying to get under control. But I feel the good news is I feel a lot better. I've eaten today, and it has not resurfaced. It has stayed down. I feel very positive about going forward, and I've had to pushed back 2 doses at this point. So hopefully next week, preferably next week, I'll be able to take chemo. I feel the same way, Andre, about the port. Like on my first chemo, I cried because the gemcitabine, it hurts so bad. My veins are already kind of messed up from, you know, having so many having a surgery and getting all of that other stuff together. So I got the port, so hopefully, you know, I can experience the ease that they talk about with the rest of chemo. Okay, good. Because I was worried. I was like, they, you know, I got the port on Christmas Eve, and I was like, what if they're wrong? What if it doesn't actually feel any better? So it's nice to hear that it does help. That it does help the process. But that's me.
It really does. And did they get you some Emila cream or some type of anesthetic to put over it before they inject your port?
Oh, is that what the lidocaine is for?
Yes.
Mm-hmm. Okay. They just prescribed it to me, and Michael and I were like, why did they give us this lidocaine? We don't know what to do with it.
Make sure before you get ready to go for your chemo, if you're at home, put some on there, and you can take some saran wrap and put on top of it. And when they get ready to inject, you don't feel it.
This is amazing. Yes, indeed. Because I didn't know, and I've been doing it without it. So I've been like, you know, okay, this is why support groups are awesome.
Exactly. I got a question for Dr. Singh. I know that in my case, when they removed my kidney, they was also looking at trying to possibly remove some of the lymph nodes as well, where the cancer had spread. And that kind of, I guess they had to kind of not go in that direction because I guess it was kind of life-threatening or whatever. So I guess, can you kind of expound upon that a little bit?
Sure, I was there, so I can definitely expand upon it. Our plan going in, as everyone else knows, it was, there's a couple of us not bringing because of the nature of Andre's cancer. We did this surgery at Walter Reed where there were some additional urologists who do a lot of urologic cancer surgeries that I wanted to work with. So the plan was to take out the kidney and lymph nodes, kind of like ones that you said you had done, but the lymph nodes, Andre, in your case, were so stuck to the inferior vena cava, it was determined to be essentially unresectable, meaning to take out those lymph nodes, we would have to resect a large portion of your vena cava. And the vena, so we have a main artery in the body and a main vein in the body. Main artery is the aorta, main vein is the vena cava, and to resect a portion of one of those arteries or veins is a big deal. And, and the patient doesn't always live through that kind of a thing. And so if you're going to do it, there better be a really, 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 really good reason to do it. Meaning the risks are worth the benefits. And so, when we were in there, we weren't expecting the cancer to be that bad, to be honest, based on your CT scans, which were not that long before. It just didn't show how bad your lymph nodes were involved or stuck to the vena cava. And that's not unusual. I mean, the CT scan doesn't give you all the information. It gives you a lot of information, but not all of it. But getting back to your question, yeah, we felt if we tried to resect these lymph nodes, we'd either get into life-threatening bleeding, and so we'd have to also resect the vena cava, which means we'd have to put a graft in there. And we thought the risks of that outweighed the benefits of trying to do that. And so we thought, let's get the kidney out, which we thought we could do safely. Even that was difficult, to be honest, but obviously we did that, safely and successfully. But we thought the lymph nodes, it was going to be impossible to get it all out, and the risks were too high.
Okay, appreciate that, Dr. Singh, because I don't think there's a real consensus as far as whether to remove the kidney first or do chemo first, and then I guess eventually, remove the kidney. So
yeah, this is a controversy not only with your type of cancer, but there's a whole variety of kidney cancers, right? I mean, if we're going to count each of them individually, we're going into the dozens. But in general, kidney cancer as a whole, which is not, exactly as you guys have discussed, there's kidney cancers and there's different kinds, and they don't act the same. So you can't lump them together. But in general, we don't know. We don't have definitive evidence whether it's better to take out the kidney or to do chemo first, because we've done many studies on this and it doesn't give you a clear answer. So doctors are kind of left to kind of making judgment decisions for individual cases based on a variety of different factors of what they think the right thing is for a patient.
Okay, because Lois, your daughter, she did the kidney. She didn't have her kidney removed yet, has it?
No,
Okay, so
because no, the first symptoms were totally relevant with the area of kidney. Uh, to see what I mean, we spent a couple of weeks, or maybe less than a couple of weeks, believing that it's COVID, because the whole thing started in February, mid-February, with a leg ache. She had some leg aching, and the orthopedics, it's called, told us it's probably because of her training. So another week went by, and then she started coughing. At the end of February, she had the second dose of the Gardasil vaccination. You know, this for the cancer of the gynecological area. What's it called in English? Anyway, I have some thoughts about that because it's a bad coincidence this year. The first dose was in December and the second dose was the end of February. But anyway, and the cancer appeared beginning of March. Anyway, she started coughing, and then 2nd March she had some low fever, which went on and on. Some visits to the pediatrician, it's nothing, but it insisted. The blood test didn't show anything special. And it was about 12 or 13 March when the pediatrician felt something in the stethoscope when she was trying to, and she felt some pain in the lung area when the doctor touched her, and we were sent to hospital for an X-ray. And then we went all through the procedure for the COVID. It was actually beginning of COVID cases in Greece. We spent about 24 hours in that special room with a bit of oxygen, some low fever, and coughing, a lot of coughing. Her cough was getting worse and worse. And after the negative test, we were sent home. They didn't want to keep people in the hospital because of the COVID cases and all that. But that weekend was horrible, horrible. A lot of coughing, a very dry, bad cough. Never heard something like that before. It was awful. A second, because coughing did not allow her to. On Monday, we went to re-examine. They wanted to re-examine her in the hospital, and then they realized that some lymph started gathering in her lung, and we were kept in the hospital in our town. And later that day, we were sent to Thessaloniki for further examination because they thought that it was some sort of pneumonia, but they didn't know if it was a virus behind it, it was bacteria, or what kind of pneumonia. But the CT was not very good in the lung area. That was done in Volos, in our city, in our town. So we were sent to Thessaloniki. We stayed 3 days in that hospital, COVID examine again, COVID check, because all the symptoms were just like COVID. And since we changed city, we had to go through this, so a lot of hours there were delays with that COVID. When we finally got to the pediatrics department, they did a lot of examinations for 3 days, and then they got. It was about 18th of March by then, and they got the lymph in the armpit. They had a very brief surgery to take the because it was swollen. Now under the armpit there was a, what do you call it, lymph node or lymph?
Lymph
What is
node.
it
Lymph,
called?
lymph
Lymph,
nodes.
Lymph node.
lymph node, right? And it was sent for biopsy, and it was done very, very quickly. And on 20th March in the evening, we had a very, very first diagnosis that we have to do with a very aggressive metastatic cancer, but we don't know the source, the original source. They didn't have a clue. They suspected something about gynecological. That's what the doctor, the person who did the biopsy said. But then I think the next couple of days, her situation got worsened. So we were sent to where we are now, actually, to the oncology for children department in another hospital in Thessaloniki, which is special for these cases. She got really worse. I mean, there was a lot of liquid in both her lungs. That was, I mean, what saved her actually was in the intensive care unit. She stayed there for 3 days, and for some hours she was put. What do you call that when somebody is unconscious in the intensive unit care? What do you call that in English? She was
When
with all these tubes. She was actually sleeping.
She was in a coma or intubated?
What do you call that?
Was she intubated or just in a coma or what?
It was a technical coma. I mean, they wanted
Medical induced coma.
right because they wanted to make her lungs some sort of the stress they had. Wanted to rest her,
yeah, I
and I
mean,
think that actually saved her because actually in the intensive care unit she got the first chemo there, and after 3 days she went to a room and we started. That was 24th of March actually, and she's been on chemo ever since. But
how is she?
her beginning was nothing like kidney or something. And the sample, the original sample, was sent to another doctor to examine it. Again, they couldn't find the source. They went closer. They said about adenocarcinoma, poorly differentiated. Actually, they said. And that the second doctor suspected ovary cancer, and because she had some liquid that area, and the CT scan mid-April was not very clear, and they suspected that it was ovary. But then another scan showed the area clear, and a doctor there said could be kidney, and that sample was sent to Athens then. So the third actually lab gave the final diagnosis, and it came from Athens. Uh,
Lois,
but they,
how, tell us how she's doing now. Because I don't think we
yeah,
saw you last
yeah,
time. I
yeah. Well,
don't
no,
think,
you,
I don't think we saw you last time, and so it's
Yes,
2 months. I mean, how is
we
she?
were.
How is she right now?
Yeah, we were in the hospital, and I cannot speak loud or participate because we have this time difference. I said that in the beginning, but you're not here. Beginning of December, we had a PET scan, which was really, really good. Now she only has two areas that are still affected, but with very, very low signal in the lung area and in the breast. But the lung is very, very improved. That is shown in the X-ray as well. The image of the lung is a lot improved. Her oxygen levels are excellent. I mean, very, very, very good. And the two signals are 3.5. You know that the PET scan shows some numbers. It was something like 8 in August, and now it's 3.5. And in the breast area, 4.5 from 9. So the final report says that there has been improvement, great improvement. Some lymphs have been neutralized. They're negative signals, clear. And what else? That they notice very, very low load of disease, as they call it now
Right.
here. I mean, the final actually sentence of the report. And
So is she? Where is she now? Is she home with you now?
yeah, we are home. We've been here for about 14 days. It's the break between the chemo rounds. Tomorrow she's going to Thessaloniki, and her dad will join her there for another round of chemo. It's the round with the bortezomib now, gemcitabine and what else? And cisplatin this round now.
And
And
how is she tolerating the chemo?
pretty well, I would say, apart from some nausea effect that lasts for about 1 or 2 days after the chemo. Surprisingly, it doesn't cause her anything else. She's strong. She's in mood. Her taste is affected after the, especially the, I think, gemcitabine has that effect. Has a bad taste in her mouth, and she wants to eat something those moments. But these symptoms last for about 2 or 3 days maximum. I give her Nexium and Zofran when I'm at home.
Right.
But the same pills. She has the same pills in the hospital as well.
Well, I mean, it
But
sounds pretty positive
yes,
compared to when we've heard you speaking before. This is all mostly good news.
yeah, yeah, actually. And we hope that in March we'll have a clear PET scan. We hope. Look forward
Okay.
to it. Okay.
Yeah,
We don't
right.
know. We don't know. We hope that the treatments will continue being effective, actually. That's what we pray for.
I
So
think
To
that's
continue.
wonderful.
just wanted to say to Michael and Kwanzaa, I did find the name. You might have seen it. I did find the name of the palliative care doc at City of Hope. I put it in the chat window and I sent it to Kwanzaa. It's Dr. Purvi Patel, Patel. And like I say, she did her fellowship, her palliative care fellowship at Memorial Sloan Kettering, and they really have a very good palliative service. So take a look at her. and talk to your docs there and see if you can get her onto Kwanzaa's team. We got the person that we referred to her was really happy with her. They liked her a lot.
Yeah, I definitely will. Me or Laura reach out to him. I was confused for a second because one of her doctors, from a different hospital we were at before was named Patone. I was like, is this the same person? It's not.
No.
And so yeah, we'll definitely reach out. So thanks for that. I also unfortunately have to go. The last member of the A team, Kwanzaa's phone was starting to overheat for some reason. That's why she just kind of disappeared. And then her nurse came in, so she was like, "Okay, I've gotta handle some stuff." And I have to go walk our fur baby, who has been waiting patiently, in the
Okay.
bed.
Well, we
And so
hope
yeah,
to
we
see you
will.
again next month.
100%. Kwanzaa actually messaged me while 10 minutes after she had gotten here, to talk about how like good she felt being here. So we'll definitely be back. Thank you all for inviting us with open arms, and look forward, Lois, to hearing the good news of continued
Yeah,
improvement next month.
the
And
same for
and
right.
Kwanzaa. Bye.
none of you should
Nice to
hesitate to
meet
reach
you.
out.
Nice to meet you.
You too.
None of you should
Bye.
hesitate to reach out between now and then. Oh, there is one thing I wanted to mention to you, which Richie knows, but Dr. Masoul is giving a talk on the internet
Tomorrow. Yeah,
tomorrow.
I know. Yeah,
Oh
Um,
wow.
yeah.
I know. I'll
Richie,
watch it.
what's the name of the foundation?
It
You put me on the
is.
spot.
Yeah,
I'll look it up
Uh,
for you.
I'm gonna look it up right quick.
Yeah,
But while
it's kidney cancer or something like that.
yeah, but the foundation.
yeah. Hold on a minute, and I'll tell you. I've got it right here.
Okay.
In fact, it is. Oh no, I don't have it because I just copied the link down.
The
Okay, but
Judy Nicholson Kidney Cancer Foundation.
There
That's
you
it. All right, Clarissa.
go. And I'm going to put the link in the chat window for you, Michael. But I don't know if it's a personal link or not. But
Okay.
but look up the Judy. There's the link to the Zoom meeting. It is at it'll be at 10:30 Pacific tomorrow.
AM or PM?
10:30 a.m. to 10:30
Okay.
a.m. Pacific.
Mhm.
I was like
30.
10:30. If it was PM, I was like, what time? Where is this thing being held?
No, 10:30. It's 10:30 a.m. Pacific, and
10:30 because I thought it was 1:30.
Well, it's 12:30 Central Time.
right,
1:30 Eastern. That's Eastern Standard Time.
1:30 Eastern. It's 10:30 Pacific time.
So 10:30. It's about 6 p.m. for Greece.
I don't know
Probably.
what's the time. Is it 10? I
Anyway,
think 10 hours, but
I'll
it's
find it.
10:30 Pacific, 1:30 Eastern. And
Mhm.
Michael, did you get it?
Yep, I got the link and the name of the foundation. And yeah, I'll look it up tomorrow to make sure the link will work. 10:30 Pacific, I'll be teaching. But I think Kwanzaa hopefully will be free.
Well,
So I'll send
look,
it to her and Lori.
here's the thing to do. Sign up, because most of the time in these webinars, if you sign up, they'll send you the link for the recording afterwards,
That's true. Yep.
right? So I may have, I think under RMC, I think I've got the invitation.
I
But
have it
if you,
somewhere. I think I sent it to a lot of people.
right. But if you go to that Judy Nicholson Foundation, you can probably sign up right there. And here it is. I've got it. Yeah, here's the jnfkidneycancer.org is the URL is J as in John, N as in Nelson, F as in Freddie, jnfkidneycancer.org. And if you go there, you'll be able to find the event, and you can sign up and you can hear Dr. Masoul. Unfortunately for Lois, he will not be speaking in his native language.
That's,
But
I'll follow. I'll follow.
but you'll manage. Okay, but you can ask him a question in Greek if you like.
Great. It won't be very polite. It won't be very polite for the other people, though. Okay.
Before we go, I wanted to just mention one thing. We are having a facelift on our website, and we're hoping to bring it out this week, debut. And then in March, we will be having our virtual walk, March the 27th. So we would like to have everyone to participate all over the world. So we'll be getting more information out, but I just wanted to share that with you. And I am really excited about our website. We have a lot of resources available to people with RMC, so I think it's going to be very, very helpful to our RMC community.
We don't have to close the meeting. It's just Michael has to go. You don't have to go, Richie.
Thanks, y'all. See you next month. And we'll actually think Kwanzaa
Bye.
might reach out to a couple of you tomorrow.
Bye.
All right, bye-bye.
Bye-bye, Michael.
Dr. Singh, where are you practicing now?
I'm in Pennsylvania. Yeah, in the Allentown, Bethlehem area.
Okay. In a community urology practice?
Well, yeah, it's a large hospital-based practice. So I wanted to be in a big medical center which had a lot of resources and was busy, and so it's that kind of a place, but a community center. It's not an academic center.
Okay. Yeah, we do a lot of work in prostate cancer. We run 12 groups a month, virtual groups like this, just for prostate cancer. I just got off the call before. We had, I think, 30 people in the group.
Great.
And that's a weekly group that we run for advanced prostate cancer. We also have a weekly group for active surveillance, which we just started last year, and there's a huge demand for that. And then we also run a low intermediary group, and we also run a group for men under 60 with stage 3 or stage 4.
That's fantastic.
So if you go to ancan.org, you'll see not only a page here for Richie and a nice picture of the captain here, but you'll see all the other groups that we run as well. And please feel free to refer any of your patients to any of our groups.
No, that's great. I mean, I think these it goes without saying that these resource groups are fantastic. We used to run one back in the Army at our hospital for prostate cancer because obviously there's prostate cancer, as you know, is so common that it lends itself to having a support group locally, but online obviously during these times is even better, especially in general. So that's fantastic.
Well, it's interesting you say that, because what happened was, I was diagnosed with T3 prostate cancer, stage 3 prostate cancer in 2007. And I was the beneficiary of some very good peer support through a group. But I realized that there were a lot of people who could not get to a group, maybe because they lived in some remote place on the on the Oregon coast, or they would have to drive an hour, or even like Andre right now. If Andre wanted to get to a group, it'd be a heck of a drive for him to get to Birmingham or wherever's closest. And then there are people that are physically disabled, and there are people who are socially disabled too. And so I had this idea that, why don't we create these virtual groups? And we started running these groups in 2010 on the telephone. And then in 2015, we moved to a video chat platform, long before people had even heard of COVID. Mm-hmm. And now we're running 28 groups a month, not just for prostate cancer, as you see, we've got all kinds of different cancers. So so yes,
Fantastic.
you're right. You know, and we're
Fantastic.
big believers in peer support. In fact, I don't have one of our T-shirts. I don't know if any of you RMC folks have bought one of our T-shirts yet, but the T-shirts say right on them, be your own best advocate. So, you know, they're very important. And we have some great speakers. We had Peter Carroll spoke to us, and Larry Klotz is going to speak to us pretty soon. And so we get some good names.
Fantastic.
Now, I'm just thinking, we've got a captain here, but you must have a rank as well if you were in for all that time. What was your rank?
I was a major.
Oh, okay. So we got look at this, we got a captain and a major.
There you go. That's right.
Okay. Carissa, what's going on in your life?
Nothing much. Yeah, nothing really exciting.
How were the holidays, Clarissa?
Yeah, it was a little tough. It was a little tough going the holidays this year, but
It was?
yeah, just I don't know. Like I miss Carlos a lot.
I'm sure. I'm sure. Well, you know, we would love
Was
to
it the
have you
first
in that
holiday?
caregiver group. When Alexa came into the caregiver group, when she had the anniversary of her loss, and she loved the group. And you know, you're so welcome in that caregiver group. If we can get you to come in.
Yeah, I was thinking. Yeah, I think I'm gonna join next time. That's like next Tuesday, right? You have
Yes. First and third Tuesday. Yeah. Yeah,
Yeah, I was
we'd love
thinking
to
about
have you in that group. And how's the new house?
it. It's good so far. I mean, like I still have like a lot of things I have to a lot of things I have to get for the house. But yeah, like yeah, and I guess that's like I don't know, like I didn't realize this, but like this is like my first time living alone. So
Oh,
so
wow.
I think and I moved like in December, so I think it was just like hitting like, like everything. And then like Carlos and me were supposed to get a house, like we were supposed to get a house together.
Yeah.
Work was like kind of getting like crazy busy, and I don't know. But
Well, support is only as far away as the telephone. You know that. So, you know, so reach out. That's what we're here for.
thank you. Yeah. So I'm definitely thinking of like joining like the support group next Tuesday.
Good.
Yes.
Okay, we'll welcome you with open arms.
I still haven't figured out how to. I like seen it like pop up like under my promotions, but like I know you guys mentioned like moving the folders from like the Gmail, but I couldn't figure out like how to move it into the
You
inbox.
mean you should get a reminder before each meeting. Do you not get a reminder?
I get a reminder, but it gets like under the promotions section instead of like my primary section.
Oh, well, you can move that, I think, and tell it not to put it there, I think. Well, I'm not very good at that, so.
I took my promotions off because I was getting confused.
Well, but you know where to. The caregivers is in the other room. It's not in this room. It's in the Barniscus room. So don't click on this link. You have to click on our other link. It's in the letter. I'm just going to make sure that you're getting that letter.
I know I got it. I'm going to get on it too.
I think you are. Well, maybe you're not. Maybe you're not. Let me just see. Yes, you are.
Oh yeah, I see. See, I starred one of them, so I think if I just click on the Berniscus room, I should be able to see it.
Yeah. There's a meeting in there right now. If you click on it, you'll join the meeting.
Oh, okay. I won't do
There's a
that.
multiple sclerosis meeting in there right now. They're very nice people. They'd be happy to have you. In fact, I've got to run over and say hello to them. So I'm going to leave you. But Richie, you know how to close out the room, right?
You're on mute, Richie.
I was actually able to open up the room, so I'm hoping. Well, I'll just hit leave, and then everybody will go out.
And it'll say to you, end meeting for all, and you'll say yes.
Say that again.
It'll say end meeting for all, and
yeah.
you will say yes.
Exactly. And I will stop recording before I end the meeting.
You don't. It'll stop automatically.
Oh, it will?
Yes.
Awesome.
You don't have to worry about that, unless you want to say something that you don't want on the recording. So I'm going to say goodbye to everyone. I'm going to say goodbye to the captain. I'm going to say goodbye to the major doctor, and hopefully we'll see you all again. Okay?
Yeah, sure.
Okay. All right,
Sure.
Rick.
And
Bye.
Happy New Year.
Thank you
Have
very
a nice
much.
year.
Thank you. Thank you. I'll see you at the next meeting probably. Bye.
Yeah, sure. Sure. Bye.
All right. So,
Bye.
Andre, I think we need to choose who's going to moderate next month.
Who hasn't moderated yet is the question. So far only me and Carissa have done them, right? Only.
I did one.
Okay. What about McKenna? I haven't seen her in the last couple. Is she still?
How's
Her mom
McKenna?
has been sick.
Does she work? McKenna works, right?
She does work. I don't think she's working now, but her mom has been sick. I'll see if I can reach out to her again.
What happens? I think did she have something else? You're talking about Robin.
Yes,
Is she
Robin.
okay?
No, it's
Yeah.
the same thing. Yeah, she's improving, but McKenna just had a lot going on, so I think she's just trying to
Right.
get it together. So hopefully,
Yeah.
she'll be coming back soon.
Any news about Joyce? Joyce?
I hadn't heard from Joyce in about a week now.
Right.
So I'll try to check out.
She did receive her burger though from the last
Yeah,
time.
yeah.
Yes, she did.
Yeah.
And she was very
I
excited.
was yeah.
And
Very nice. And
Delana is
Diana
coming on, but
and
we gave
Diana was supposed to join us tonight because I had a chat earlier on today, but probably something happened and they didn't show up in the meeting.
No, I had sent out emails, so I don't know what happened, but we'll try to.
She knew about the meeting because we talked that she was going to show up because they finished the 4th cycle of the chemo. Nicholas and Fenina are doing the same thing, and they are about the same phase of these rounds actually. Only that Nicholas, I think he was diagnosed a bit later than Fenina, a couple of months later, something like that, right? And he had his kidney removed, if I'm right.
Right, eventually, yes.
Yeah, we didn't have any surgery with Fenina. And nobody, I remember what you said about radiation. We were not told yet about any, I don't know when do they do radiation? When there is only one spot?
So in my case, the radiation, I mean the chemotherapy shrunk the cancer enough, and they wanted to kind of, Dr. Masao kind of say double team it. So he wanted to do the radiation in conjunction with the chemo to kind of make sure that it attacks those lymph nodes. Because the problem area, he said, was the lymph nodes that were close to the kidney that was taken out or whatever. So, and Dr. Singh Dr. Singh already said like that. Those lymph nodes were, you know, it was worse than what they previously expected. So the chemo was able to shrink them down enough, and then in conjunction with the radiation, they was able to attack it and
Yeah.
kill those cells.
Yeah.
Well, all right, you guys. It's been an hour and a half. It's been
Okay.
great.
All
Thank you
right.
very much.
Special thank
Thank
you for
you.
Dr. Singh joining us. Appreciate you, Doc. Appreciate it.
Come back
My pleasure to be
again,
here.
please.
Thanks for having me, guys.
All right. Anytime you
Bye.
want to join, anytime you want to join, log in and join, you're free to welcome.
I
And
appreciate that. I appreciate it's just valuable for me to just to hear patients and families and just how you guys talk is obviously different than way a lot of people will talk with their physician, and so I learn things as well. And for example, that talk that he's going to give tomorrow, I think if I can break free for a little while to listen to some of that, I think it'd be a great thing to listen to him. So I've heard a lot about him from you, Andre, and so yeah, so I appreciate being here.
okay, and if you run across any RMC patients, feel free to refer them to the group, because
Of course,
you
absolutely.
understand you understand when you give somebody this news, it's a tough conversation to have with your patient. So
Absolutely.
they need all the support they can get. Richie, I think we're ready to close out. Appreciate everybody for coming. Hope everybody have a happy new year. God bless everybody.
Happy New
Thanks for
Year.
You too. Happy New Year.
Happy New
Bye-bye.
Year.
Bye-bye.
Bye. Bye.
Bye-bye.
Bye.